today encompasses a lack of access to resources that in turn can be detrimental to a patient and individual care. As of 2012, Nevada ranks 49th in the nation when it comes to per capita state and local government expenditures for healthcare programs. This lack of money dedicated to healthcare has served as a barrier to individuals seeking care on different levels. Whether it has to do with vaccinations, rehabilitation, or insurance coverage, this is an issue that desperately needs to be addressed. The common ground and focus of all of our organizations has to do with addressing this issue and increasing accessibility to resources and improving overall individual health.
At Family Ties of Nevada, I made health happen in many ways. First, by getting out into the community at special events and talking to families about the access to resources they may not have been aware of, such as complex health systems, insurance plans, public assistance programs, and other services. In addition to making phone calls, giving out resources, and answering questions about the family's needs, being a part of this organization has made a positive impact on many individuals. For instance, Family Ties of Nevada has helped 68.9% of the white population, 43.2% of the Hispanic population, 3.7% of the Black population, and 6.1% of the Asian population.
Nevada's immunization coverage ranking for children aged 19 to 35 months is now 31st in the nation, an improvement from 38th in 2014. This ranking reflects a 5.5% increase in the vaccine coverage rate for the early childhood age group to 71%. Immunize Nevada has provided services that continue to increase the amount of children immunized, especially at the elementary school level. We have increased the flu vaccine uptake in elementary schools by going to our local schools and offering flu shots to students even if they don't have health insurance. I have made health happen by attending events and educating people about vaccinations. Immunize Nevada can also be a place to go for any questions or concerns about vaccinations. By increasing vaccination access to our community proves not only beneficial to the individual, but making a healthier community overall.
In comparison to 2016, Nevada Physical Therapy has seen a drastic increase in its patient census over the past year. I was able to make health happen by providing the patients with the resources they need to be successful both inside and outside the clinic. By increasing the patient's access to resources, such as bans and handouts, it in turn drastically benefits the patient by making them more independent. They are able to complete their home program on a regular basis on their own without having to be in the clinic. As a result of this, it allows the patient to save money and minimize the amount of copays through insurances or out of their own pocket. With the help of Nevada Physical Therapy, I have been able to overall improve the experience of the patients and motivate them to remain driven with everything they do in therapy. For this will not only help them during their time at therapy, but it will strengthen them as an individual and prove beneficial in life as a whole.